be heading towards suppression as opposed to eradication?
I support what National Cabinet has endorsed. That is zero community transmission. Anyone who thinks we're going to eliminate or eradicate this disease unfortunately doesn't appreciate what the pandemic means. But what we have all signed up to as state leaders is zero community transmission, and that is something New South Wales strongly supports, endorses and works towards. In fact, the restrictions we have in place now are to get to zero community transmission, but we do it in a way which doesn't overburden our citizens every single day. And we also have to appreciate that when you are welcoming back overseas travellers, Australians coming back to Australia, you do have to accept that the disease is still there. And I don't think there's any state in the nation that hasn't had cases come up in hotel quarantine. So to suggest that you can somehow eliminate the disease from Australia, I don't think is realistic. And that's why it's really important for us to support the National Cabinet strategy. Now, every state might have a different way of getting to zero community transmission, and that's a matter for them. But I don't believe keeping your borders closed and inflicting pain and suffering on thousands of people is the way to go. That's just the New South Wales strategy. But all of us have that aim of zero community transmission.
The WA Premier said that all,
I'll come back to you, sorry.
The WA Premier yesterday said that all states and territories except New South Wales are working on an elimination strategy as opposed to suppression. The Queensland Premier today said that that's not the case in her state. How can people trust the premiers on what's being agreed to at National Cabinet when there's such inconsistency between messages?
But I think the best thing to do is just to look at the decisions of National Cabinet. Zero community transmission is our aim, and that means we don't want to see the virus spread in the community. And I think that's logical, because that's what we can control to an extent through public policy. We can't control the number of people who come back from overseas, Australians who have the disease. We can control the number of people coming back, which is why I'm very pleased, and I have to say as a State Premier of New South Wales, who's welcomed back 100,000 Australians since March last year, I'm pleased we're halving the rate for the next month to give us a pause, to give us a rest, to evaluate what the new strains of the virus are doing. And I appreciate that for some families that causes heartbreak, but we've certainly been lifting our weight on this, and it's a fine balance. Imagine if you had a loved one who's been stranded overseas somewhere, wants to come back home. It's easy for us to be critical of people wanting to come back home, but if that was your loved one, we also have to consider those compassionate issues. I'm relieved that we'll be pausing the rate for at least a month, so it's pleasing that New South Wales will take in 1,500 Australians a week rather than 3,000. It gives us a break, it gives us all those workers, and can I thank all of our quarantine workers. It's an unbelievable job they're doing, whether it's the health, the police, the federal agencies which we work with, the cleaners, everybody in the system, the hotel operators, everybody in the system has done an unbelievable job. But this pause allows us to consider what the strains of the virus are doing, consider our settings moving forward. But to suggest that we can somehow eliminate this, I mean, look at New Zealand. They tried the elimination strategy and then they had cases pop up again. So you can try and adopt the elimination strategy, but it's not realistic. What we should. I'm sorry.
Back to the question originally, though. Is there an issue with how the
I'll just finish that and then go there. Sorry.
Is there an issue with how the decisions of National Cabinet are being communicated directly to the Australian people, given that the states are saying different things are being decided on?
Look, that's a matter for state premiers. I'm someone who makes decisions on behalf of our government based on science, based on the facts, based on the health advice. That's what our citizens need and deserve, and it's up to others as to how they lead their states. I'm not going to comment, even though it's very tempting sometimes to respond in certain ways to comments others make. I'd prefer not to. I prefer to lead in the way that I think our citizens want me to, and the way they want our government to respond to the pandemic, which is based on health, science and the facts. National Cabinet, can I say, is an incredibly important forum because it allows us to have advice from the federal health agencies or the chief medical officers combined. Plus it also allows us to compare what's going on in different states, and that process is critical. And those decisions that we take from National Cabinet are also critical. But how you get to those decisions or how you get to those targets in every state depends on the governments of those states. And certainly we're very clear in New South Wales about our strategy, about our plan, about what we feel is in the best interests of our citizens.